Hi, everyone, and welcome to our 12th episode of Medical Cannabis Now. Now, there are still many things about medical cannabis we don't know about, but it is clear that cannabis can dramatically affect our brain. You can find high levels of naturally occurring cannabinoid receptor 1, or CB1, in the brain, especially the cortical areas, midbrain, and hindbrain. However, few are found in the brain stem, which is probably why cannabis does not directly affect our breathing system. Overall, this suggests that naturally occurring cannabinoids, a part of our endocannabinoid system, play a role in emotion, memory, pain, and movement. Check out our blog to learn more about the endocannabinoid system. Now, in this segment, we will discuss the different ways patients are utilizing medical cannabis to prevent and or treat symptoms of dementia, such as Alzheimer's and Parkinson's, encourage healing in acquired brain injury, epilepsy treatment, and or improve overall cognitive functioning. Alzheimer's disease is a progressive brain disorder that is often characterized by 7 stages of decline in cognitive functioning. The prevention or treatment of Alzheimer's disease is not a common reason for patients to use medical cannabis. However, it is interesting to note that in 2001, scientists employed by the U.S. government Department of Health and Human Services filed a patent for the applications of cannabinoids as a possible neuroprotectant in neurodegenerative diseases, and they named CBD, or cannabidiol, as a major proponent. In this patent, they state that CBD and other cannabinoids have antioxidant properties that can prevent oxidative cell death, often seen in conditions such as Alzheimer's disease. Some studies show that the endocannabinoid system is upregulated or activated when the brain starts to show changes as part of the disease process of Alzheimer's disease. Another study shows that CB2 receptors occur in high concentration around amyloid plaques, which are improperly folded proteins that are known to develop and accumulate specifically in Alzheimer's disease. When these CB2 receptors are activated, it calls on macrophages, which are cells that can come in and remove these plaques or eat away at them. In addition, it is said that cannabinoids can help with inflammation and neurotoxicity, often seen in Alzheimer's disease. A few clinical trials have identified that cannabis can help manage behavioral symptoms in people with dementia, including agitation and aggression. The Alzheimer's Society of Canada is continuing ongoing research around the effects of cannabis on both mood and anxiety in dementia patients. They have noted that cannabinoids interact differently with the body and could be a safer alternative to traditional medicine that can cause harmful side effects. Now, in practice, there are reports from our own patients that CBD oil and sometimes low doses of THC help with symptoms of agitation, cognitive dysfunction, and improve their appetite. So as we said, medical cannabis can improve agitation, aggression, and poor appetite seen in patients with any form of dementia outside of just Alzheimer's. There are reports that long-term care patients suffering from any kind of dementia greatly improve when using CBD-rich oils, and sometimes a combination of THC and CBD oil. It can lessen the burden on the patient, their family, and their care team. There is also a growing body of patients using medical cannabis as a preventative measure, especially those with a family history of dementia or early onset dementia. The reason for this is the possible role that CB1 receptors play in synaptic transmissions, i.e. the connections in our brain. And a dysfunction of this connection or these connections is often implicated in dementia. Many patients will use CBD to prevent cognitive decline. However, there isn't enough evidence or research to show that cannabis greatly improves cognitive function in healthy patients. But there is evidence that cannabis, especially CBD, can improve cognition when there is a dysfunction. I want to also mention Parkinson's disease here, as it has its own unique set of symptoms. There are cannabis receptors found in the putamen and globus pallidus, areas that affect that are affected in patients with Parkinson's. CBD is shown to possibly improve the dystonia, which are uncontrollable involuntary muscle contractions associated with Parkinson's disease, as well as improve other symptoms that are associated with any type of dementia. So next we'll focus on acquired brain injury. Now, acquired brain injury or injuries encompasses any insult to the brain that occurs after birth, such as physical trauma, stroke, and or alcohol or drug abuse. Now, patients who suffer from an acquired brain injury often experience a large range of symptoms and normally come to the clinic hoping to use cannabis for things like insomnia, pain relief, and to help improve their anxiety or depression. However, medical cannabis could potentially prevent damage to the brain, namely with the use of CBD. This has been demonstrated in some studies on animal models. While it didn't decrease the damage that's already been done, it decreased further damage from inflammation, excitotoxicity, and other metabolic stresses on the brain after it has suffered these types of injuries. Furthermore, CBD has been shown to act on other receptors outside of the endocannabinoid system, outside of just CB1 and CB2. And it helps with neurogenesis and to stimulate synaptic plasticity. In simpler terms, there is potential for CBD to help generate new neurons and improve the ebb and flow of those neuronal connections. Finding the right balance between CBD and low doses of THC may help brain injury patients with their mood symptoms, physical pain, sleep, and evidently their brain health and recovery. So because of cannabis's multifaceted effect on our brain and the diverse arrangement of the endocannabinoid system, there are many more applications of medical cannabis. For example, for years, researchers have looked at the effects, both short and long term, of medical cannabis in the treatment of epilepsy, as it has made a profound impact on families with children suffering from treatment-resistant epilepsy. Another example of another popular condition to use medical cannabis for is attention deficit and hyperactivity disorder, or ADHD. Different strains have been shown to help our patients, both pediatric and adults, in improving their focus and possibly helping them wean off their pharmaceutical medications for ADHD, which may be causing adverse side effects. We will look into the implications of cannabis on these different conditions in future episodes. Please share in the comments below any other conditions that you want to learn more about that may benefit from medical cannabis. So as always, we do have a couple of very interesting questions that I will try and answer here. The first is, my dad has been diagnosed with early stages of dementia, and his doctor doesn't know if cannabis is a good treatment option. Do you have any recommendations on what we could do? So it is always a good idea to consult with your family doctor first, as your dad has done. You can ask the doctor to send us a referral, and we can book him in for a consultation with one of our healthcare practitioners who specialize in cannabis-based medicine. After the consultation, we would send a consultation report to the referring physician. During the consultation, we would discuss if cannabis is a good option, as it is dependent on the individual. Barring any contraindications, most of our patients find there is no harm in trying medical cannabis for their conditions, especially CBD, since it has a very low side effect profile. With that being said, patients don't have to have a referral to come to our clinic. Our next question is, I have seen conflicting evidence that cannabis can impair memory. Would this be an issue for a patient with Alzheimer's or dementia? And how would this be addressed at your clinic? So this is a great question. The evidence is not necessarily conflicting. It's important to look at what these studies are looking at specifically. What strains are being used, the demographic, when did these patients start using cannabis, and how long were they followed for, amongst other things. So for example, a study looking primarily at long-term effects of CBD did not find any evidence of memory impairment or any kind of long-term impairment or side effect. In fact, they said that CBD may have helped improve memory. Now, in the clinic, we would address this issue by starting low and going slow, the cardinal rule of using medical cannabis. We can help make necessary adjustments based on the health profile of the patient and their response to the medical cannabis as they start treatment. So there is no doubt that cannabis and cannabinoids are involved in multiple pathways in our brain. We are still trying to research and better understand what role they do play and how we can utilize it in medicine as a treatment or preventative measure. While there are studies that demonstrate potential long-term effects of prolonged chronic THC use, especially from a young age, there have been no demonstrated long-term effects of CBD use. It is considered non-psychoactive and commonly used in many different demographics. This doesn't mean that one should avoid THC altogether, but proper dosing and balance is important. For now, there may be a place to use medical cannabis as a more well-rounded medication to assist patients suffering from dementia or brain injury, or for those who simply want to prevent these conditions. As always, it is to your benefit and important to your health to consult with a healthcare practitioner before using medical cannabis for health purposes. Thank you so much for listening, and hopefully we'll see you in our next episode of our Medical Cannabis Now series. Please don't hesitate to reach out to us with any of your questions. We are available 7 days a week and encourage you to reach out. Thank you.